Hello, everybody. I'm Andy Brotzeller. I'm a member of the communication team here at Children's Wisconsin. I'm joined by Dr. Mike Gutzeit, our Chief Medical Officer. And Mike, you're joining us today as was some news from Pfizer today. So can you briefly share what that news was?
Good afternoon, everybody. Yes, there was some very exciting news that Pfizer has passed along, and that is that they have now requested the FDA to begin the review process for their COVID-19 vaccine to be available to 12 to 15-year-olds.
So to clarify, Mike, the vaccine isn't approved. This is kind of the first step or the next step in the process to get us to that point.
Absolutely, that's a very important point. First of all, the only approval being requested is by the Pfizer vaccine, and that has to go through an approval process that has been established by the FDA and the CDC, much like what happened with the 3 vaccines that are currently available for use in the United States.
And then for one other piece of clarification on that, Pfizer is the only one that has been approved down to the age of 16. The other vaccinations here in the US is only down to the age of 18. Do I have that right?
That's correct. Yes, Pfizer is the only approved vaccine for those 16 years of age and older.
Can you share or for us remind kind of what is that next step and process? How does that review process work? Who's involved?
There's a very thorough and rigorous process to assure that that the process is safe as well as the vaccine is safe. So the information that Pfizer has collected will be shared with the FDA and the CDC, and both of those organizations have internal processes, multiple steps, checks and balances to assure the data that's submitted is accurate, that it reflects the actual safety of the vaccine, and that will result in a vaccine that is effective and safe for use.
I think one of the likely questions following that then is how long, Mike? How long does that process take? Is there a set schedule for it?
The timeline for that is really dependent upon the scientists making sure that they have the information in a way that they can look at it, assure that there's a safe process. We don't want to rush the process. We want to make sure that process is followed, the appropriate checks and balances that are in place are there, and that the vaccine is ready when that information is available.
Mike, we were talking a little bit earlier today when this news came out of just that it happened today. What was your reaction when we heard the news?
This is exciting news. This is very exciting news. The sooner we can get safe, effective COVID vaccines into as many people of all ages as possible, the closer we get to overcoming the pandemic of COVID. And this is very exciting for that reason. This gives us a chance to move beyond what's been going on over the past 14 months and get beyond COVID.
Question here in our chat, we'll take our first one, and it's that kind of that general sense of what's your recommendation? So if parents are asking or if they're still trying to make their decision of having their child vaccinated once they would become eligible, right, which still hasn't happened unless they're 16 or over, what would your recommendation be to a family or to a parent?
In general, what I would say is that the vaccines that have been released in the United States are safe and effective. They followed a very rigorous process. I think it's very important that parents seek information from trusted sources, CDC, caregivers, others who are informed about the vaccine, and that they also have a discussion with their kids who are potentially going to receive the vaccine. I think that's very important also.
How about, are we currently vaccinating patients 16 and over, Mike?
Yes, the State Department of Health Services opened the doors wider to allow access to the vaccine. So we are currently offering immunizations to those 16 and older. We were doing it before that in a very specific group population that had high risk conditions. Now we're opening it up to a broader audience of 16 and 17-year-olds.
And why broader? We are still keeping that a little bit more focused, based a little bit on our capacity, but also the supply of the vaccine. So we are only vaccinating kids with certain health conditions at this time in that 16 and over group.
What we're doing is we're balancing the supply that we have with those who are most in need of the vaccine. So we're trying to target those who are at the greatest risk for infection from COVID, and assuring that we can get the vaccines to those first. But as the supply becomes more available, we'll continue to follow the guidelines established by the Department of Health Services.
And so like most health systems, we are sending invitations out to those patients and families that meet those, have that greater need, have maybe additional risk, and inviting them to make appointments. Families, we are not at the point of families being able to request appointments.
Correct. Children's is reaching out right now intentionally to those that need them, and we're working on developing a process to open the vaccine as much as open up the opportunity for vaccine as much as possible.
This next question, I think, ties into a couple that have come into the chat. And why is it just important for people to get vaccinated, whether it's 16 and over, those who are eligible now, adults who are eligible now, and hopefully in the future, this younger group?
Yeah, thanks for that question. Again, I'd start with the exciting news about this vaccine being potentially available when it passes through the process of 12 to 15-year-olds allows us to have more people vaccinated. The reason that that's important is because this will protect ourselves, it will protect each other, it'll help us to start to return to more activities safely, and it protects members of our family as well as those that we come in contact with. You know, as a pediatrician, I really truly believe that the best treatment is prevention, and vaccines are one of the most effective ways to provide protection, not only for those who are at risk, but also to those who are healthy and allow them to continue to remain healthy.
I have another question here, Mike, from our chat, and it's asking about our vaccination efforts and if we've been limited or only vaccinating patients.
I'm sorry, Andy, if we've been limited what?
If we are only vaccinating patients, or has our vaccination efforts been greater than just what we're doing at the hospital?
We've been able to partner with a number of different organizations in order to provide vaccines, not only within children's, but outside of children's. So within children's itself, we've been vaccinating patients as well as providers and others who are part of our system and who are associated with our system. We've also been able to partner with Milwaukee Public Health as well as Medical College of Wisconsin at sites like the Wisconsin Center to immunize. We focused on immunizing educators when they became eligible because we feel that the more that we can assist and be part of the community effort to roll out vaccines and get individuals vaccinated, the better off we all are for the public health.
Somebody's asked us just to follow up on a previous question on the timing, Mike. Now that Pfizer has made this request to the FDA, what do we feel the timing? How long does that process take?
I've been the actual timing itself will depend upon how long it takes for the process. I wish I could say it will take X number of weeks, but I think the most important focus on that question is really let's follow the science and the safety that was established to allow the 3 vaccines that are currently in use in the United States to be given FDA emergency use authorization.
We've had a couple of questions, Mike, that are related to the variants, which we've been hearing more about over the last few weeks. I think in many ways that is related to our vaccine efforts. But let's first start off with that question of the variants and what we are seeing, and are those different or impacting kids differently than what we were seeing with earlier cases of COVID?
Let me start by saying thank you for that question, because we have seen over the past several weeks that there has been an increase in the number of COVID positive cases, especially in the 14 to 17-year-olds in the pediatric age group. And this is concerning. We do know that one of the variants seem to affect kids and cause infection, are more likely to cause infections in kids. And the state Department of Health Services reports that there are 4 variants that have been detected in Wisconsin at this point in time.
Having a different type of impact, what does that potentially mean more broadly, and or what does that also tell to you on the importance of vaccinations?
Yeah, I think it's very important, even more important now that we really ramp up our vaccination efforts and continue to promote vaccines as the most effective way to prevent against disease from COVID. One other thing I'll say is that it was exciting to see that within the past week, the State Department of Health Services has shown that about 10% of those 16 to 17-year-olds have received at least one dose of vaccine. So there seems to be excitement and enthusiasm for wanting to get the vaccine in that age group.
And I think our own experience here with those we are vaccinating is that we have not had problems filling our clinics and appointments, so that a number of families really are saying yes and getting this when they become eligible, which is great news.
Yes.
Quickly scanning over our questions here again. Let's kind of stay within that same topic, Mike, on the variants and still the vaccines, but with what we're seeing in how it's impacting kids a little bit differently, is at this point, do you think that there is a reason to be rethinking or reconsidering steps about kids' activities, whether that be sports or schools and those type of things families and kids are doing?
These are the questions that are asked very commonly and appropriately. People want to know how soon can we get back to our usual activities? When can we do that safely? And I would underline safely. As more and more schools come into session, there are very good safeguards in place that school districts are using. And as far as resuming activities, I think what we'll probably need to do is continue to follow the data as it becomes available. COVID has thrown a lot of curveballs at us over the course of the past year, and we've had to make modifications and adjustments on the fly. As we watch the cases rising in number, we'll want to be very cautious about allowing more activities that might promote gathering and might also cause more spread of the virus itself. I do want to also emphasize one thing that I think is really, really important. The vaccine is a very important strategy, but washing hands, wearing a mask, and watching distances is still very, very important. Also, we want to continue to follow those things, and those efforts combined will help to decrease the spread of infection in Wisconsin.
My understanding in talking to you and others, right, is these are some of the most effective vaccines that we've seen against some diseases. But while that's the case, right, they're not 100%. And particularly why we don't have herd immunity or a lot of people vaccinated, those things you just said, wearing a mask, washing your hands, watching your distance, continue to be the most important effective things that we can do to reduce the spread of this virus.
Yeah, those will continue to be very important strategies, and you are absolutely right. No vaccine is 100% effective. These vaccines are very effective in the realm of vaccines themselves. They're on the higher end in terms of their effectiveness, but again, not 100% effective.
I think this will be our last question, Mike. It goes back to our vaccines. It's a little bit of both what we have seen in employees or adults, but also if we've seen anything in this early term with kids about symptoms, those symptoms about after getting the vaccine. Are we seeing anything different, or is the data any different? Is that available yet in terms of what are the symptoms kids have after getting the vaccine?
Our experience has been very similar to what we see in adults, and that's very typical for most vaccines. Most people experience a bit of soreness, perhaps a low-grade fever, maybe a little bit of tiredness after the vaccine, but it's nothing that is unusual or different than we see with, let's say, for example, the annual influenza vaccine. So these vaccines are very safe, they're very effective, and we are not seeing increased numbers of side effects or severity of side effects with the vaccines themselves.
Looks like I might have prompted a couple other questions that I think we have time for before you have to get to your next thing. There's been some reports, and you can look at the numbers, and it's certainly true that we have seen an uptick in the number of kids testing positive for COVID-19. I think that's part of the state data. While that's true, Mike, when I looked at that information earlier today, my interpretation would be is that those numbers are small, particularly relative to what we saw in the fall and early winter. Am I reading that information accurately?
At this point in time, the numbers do not reflect the severity that was present in the fall of last year. That is correct. And we are particularly seeing the rise right now in the pediatric age group. And I'm talking about from birth up to 18 to be in that 14 to 17-year-old age category. That's where the rise is. It's modest, but it's there. And so like everything else that's related to COVID, we want to keep our eyes on that, watch that. And that's why this information about the potential for a vaccine for 14 to 16, 14 to 17 year, 14 to 16 year old, 12 to 15 year olds would be very effective. Too many numbers going around in my head. Sorry about that. 12 to 15 year olds.
Before we sign off then, Mike, any last kind of words, or again, if you're speaking directly to families who are hearing this news or are trying to make a decision about getting their kids vaccinated in the future, is there any last things you'd want to tell those families?
Well, first of all, I'd like to thank all the news professionals who took the time to listen today and to ask those great questions. What I would say directly to families as a pediatrician, I feel that using vaccines is one of the most important tools that we have in the fight against not only COVID, but against other preventable diseases. And I would encourage everybody to seek information that allows them to have the best informed decision and use valuable resources such as the Wisconsin Department of Health Services, Children's Wisconsin, our providers, get the best information that you possibly can and make the best informed decision.
And then of course, wear your mask, wash your hands, watch your distance, and then as you just said, get vaccinated.
That's right. The vaccine is one part of that, but those other important pieces of washing your hands, wearing a mask, and watching your distance will continue to be parts of what we do as we said over the past few minutes. Thank you.
Dr. Gutzeit, thank you for your time. As always, as Dr. Gutzeit said, thank you for the members of the media who joined us. As always, if you have follow-up questions, please reach out or send an email to a member of the communication team at Children's. Otherwise, that will do that for this afternoon. We look forward to getting more information and updates on this vaccine approval process. Thanks, everybody.